All right, good morning, folks, and welcome to the Palliative Care Friday Chalk Talks. Today's episode is on compassion fatigue versus burnout, discussing some of the differences and ways for us as clinicians to cope. This episode is a little bit different from most of ours, in that about three-quarters of it is not going to be recorded so that our live palliative care audience can share a bit more freely without a recording on the internet. So, our returning guest today is the fabulous Jen Greenwood. She is our palliative care social worker at St. Luke's Hospital here in Milwaukee, and she helps us guide our palliative care patients and our palliative care team across a wide range of different challenges. So, Jen, welcome to things. I will yield the floor to you, and when you're done, let me know, and I will hit the stop recording button.
Okay, thank you, Marty. Thank you
Yep.
for the introduction. Um, I greatly appreciate it. Um, well, good morning, everybody. Compassion fatigue versus burnout, and what's the difference? And how can I cope? This is something that throughout my career, I have never was taught this in school, not undergrad, graduate, clinical, a little. But it wasn't until I wanted to discover myself what it was and how to be a more present person, not only with my patients and their families, but also with my own family, who was young at the time, and I needed to be present for them and they needed their mom. And so it really taught me from an early point on that I needed to set boundaries within my career and myself to kind of preserve my resources to be present for everybody. So my next slide uh, is the definitions. So by definition, it's feeling the strain of others' painful experiences. Sometimes it's abuse or neglect stories, other traumatic stories, abuse from various times in a patient's or family member's lifetime. Sometimes it's the patient, sometimes it's the family member who is the victim of the abuse from our patient, and that is hard too. Um, some of the stories that we hear, some of them you cannot unhear. The images that pop up in your head, sometimes you can't undo those. And over time, it, if you don't know how to cope effectively, you neglect your own self care and reduce your ability to empathize with others and truly put yourself in their shoes of what they may be experiencing and feeling, which in order to be, I think, for me especially, I want to be able to be present and to hear what anyone I'm talking with, what they're saying. Otherwise, I don't feel like I'm really doing them a very good service. So I found some numbers, and this was just last year. So doctors experience compassion fatigue. Over 51 reported saying that they did. Nurses, 80%. And other healthcare professionals, 59%. None of these numbers surprised me. The last, it ever seems like since COVID, a lot of things have gone on. A lot is going on in our nation right now, and sometimes even setting boundaries with patients and family members when you go into a room and comments start being made. It's learning how to set those boundaries and to not let it bleed and affect the care that you're providing for them. My next, my next is the signs and symptoms of compassion fatigue. And these are just some. There is a lot of different things that you could be experiencing. Physically, just exhausted, mentally, emotionally, physically. You're not sleeping. You're having nightmares. You're thinking too much about your work, critiquing yourself of when you met with maybe certain patients that could have been triggering for you. Increase in headaches. You're calling in sick more frequently. A lot of muscle tension, those tension headaches, and just your body just feels worn out. Your I know when I am feeling more fatigued myself, I, I know what I need to do to cope effectively, and I'm not doing those things as frequently. As far as behaviors, that's where we see more alcohol use, more illicit drug use, overuse of prescription medications that have been subscribed um, or prescribed. I'm sorry. More anger, just hot-tempered, forgetfulness, difficulties separating your personal life versus your professional life. This is, which hat are you wearing? And sometimes I have to remind myself of, depending on the day and depending how many patients I've had in a row. Okay, in between, I know I always, I kind of take a breather. I walk around for an extra about 5 minutes just to clear my head, what I've heard, what I've just experienced, because that has helped me a lot. And I think being more present for my next patient and family. Now, psychological, again, these are just a few, but feeling guilt, feeling increased sadness, sometimes more tearfulness, loss of hope, lack of having empathy for other people, cutting them off, kind of being short with them, not listening to patients' concerns or minimizing them, dreading coming to work. That's never good. Anxiety, second guessing what you're doing more frequently. We always have some self-doubt sometimes, but when you're second guessing just everything, that's a big flag. Um, oh, keep on hitting that. So burnout. We want to try to prevent this stage, but ultimately, I've been here, I've recognized it, and it's by definition a state of emotional, mental, and often physical exhaustion brought by prolonged or repeated stress. So we are hearing and experiencing these traumas, these stories. Maybe it's a difficult patient that is very triggering for you. Um, and that's where taking time off, which I feel that we never get enough time off to really disconnect from our phones, from our work, and just do the things that we enjoy. I wish we had more time, and I wish there would be more recognition of, especially us being healthcare providers, having more time to take care of ourselves. Because sometimes, depending on what we're doing and with these more stressful times, sometimes that's needed in order to recharge. So how do you know? Burnout is the physical and mental exhaustion, no motivation to work, and just you're hot-tempered, you're irritable, you're easily set off. Just even the littlest things annoy you. It could be with your coworkers, with the people that you are consulted with, the patients and their families themselves. Um, you feel less compassionate for those that you're providing care for, less patient, cutting them off and short because you just don't feel like hearing it. Feeling like you no longer do your job effectively. And for, I know for myself, I don't like getting to this point. I try to prevent getting to this point, but I have throughout my career. And it's not a good feeling, which is why this and providing good self-care is really important to me and just being present for not only my patients, um, but once I get home too. Uh, turn going forward. Okay, so developing resilience. What is your plan for yourself? And I know that we're kind of going through like all of these, and compassion fatigue has different stages. But I kind of want to do an overview so that we can use the latter half um, to discuss and people share what they're feeling, any questions. Because I know everybody, what works for one person isn't going to work for another. So, what is your resiliency plan? And this changes in time. What I used to do 10 years ago, 5 years ago, I've made tweaks here and there. Um, I've learned to acknowledge the emotions that I am feeling, whether that's writing them down, actually saying them out loud, um, the mini breaks between your patients, taking a breath, checking in with yourself. How am I feeling? Especially if you just heard a lot or were with a patient for over an hour, just because they decided to open up. They felt that you were a safe person. Um, oh, and my favorite one, saying no more often to things that, do you really need to do this? Do you have to do this? I used to be a yes person. No, I had to learn the hard way and say no because I know it'll get done without me because I recognize it'll still get done, but it can be delegated to somebody else. And say yes to those fun activities, to doing things with your spouse, with your friends and family, whatever makes you happy. Taking time for those self-care activities. Um, I enjoy my walks and I can just plug in and listen to my favorite music. Um, I know for me, I get a massage once a month, and that's kind of like a treat to myself. Um, and that's where delegating tasks at home and at work. We can't take it all on. That's impossible. So it's dividing up, maybe making a list of, okay, these are my tasks. What are the most important ones and the ones that are priority? And going from there. And oh, the overthinking. Are you overthinking? Are you thinking and critiquing yourself and being more critical? and be sure to set those boundaries because patients will try you. So will their family members. Over and over. See how far they can push you. And debrief with a coworker that you trust, your manager. Make sure that you are stopping to eat and stay hydrated. Um, get regular exercise. It's good for the body. It's uh, great for the mind. Um, and then looking at the balance between your work and your personal life. I've definitely had to reevaluate this over the years to make sure that I was making sure that I was giving my family what they needed as well. Because my kids definitely let me know it. Are you almost done with your notes? And are we going to get to go to the park when they were younger? And so now it's when I get home, I'm mom and I'm a wife, and so it's changing my hat that I'm wearing. And there's always, I know Aurora just is rolling out a new EAP program or getting your own therapy, whatever you feel comfortable with. Um, it's it's a great resource of talking about it with somebody who is a who is and hopefully will be objective. And I just word of caution, if you do try therapy, you may have to kind of interview and go through a couple of therapists before finding the one that's for you. And build a diverse support system. Don't just put it on one or two people. That gets to be a lot for them too. I know it's getting cold here in Wisconsin, but get outside. And if we can discuss this too later on. Any other suggestions that people have? I'm always open of what and hearing what other people are doing. And let me see. So prevention, setting realistic goals for yourself before you go see patients. I usually make my priority list for the day. Sometimes I get it done, sometimes I don't. And I know that. I set my goals high, but I also, at the end of the day, know my realities and my what I can do. And sometimes it gets changed, and I have learned through the years to just go with the flow. Recognize when you have good visits that go well. There are going to be not great visits. They happen to the best of us, and that's okay. Um, Sometimes I think we forget that we're human. And it may have been that person just not ready to share. And making sure that you follow through on your self-care and you're not selfish for taking care of yourself. I can't emphasize that enough.